Hello everybody, Dr. Court here from the Vreeland Clinic, and today we're going to bring you another video blog, and we're going to be talking about Alzheimer's disease. It's a very important subject. Alzheimer's disease has shifted from the 7th leading cause of death in the United States to the 6th leading cause of death in the United States. That's above diabetes, so it's very, very important. 96% of those people diagnosed with Alzheimer's disease are above the age of 65. And why is that important? Well, in 2011, the baby boomer generation, the first of them anyway, turned 65. And then by 2029, the entire baby boomer generation will be 65. So this will put a very large strain on the healthcare system. Now, there are some primary risk factors associated with Alzheimer's disease. Genetics is one of them, and aging is one of them, and neither of those can we do much about. However, there are some secondary risk factors that we know significantly increase the risk of Alzheimer's disease. Low education level is one of them. What that really illustrates is that if we don't use our brain, we tend to suffer the consequences later in life. So the goal is keep learning, keep doing things, keep your brain active as much as possible. Heart disease, high cholesterol, those are biggies. You have to make sure that your heart is healthy, and you have to make sure that your cholesterol is in check. Those are biggies to watch out for. And then metabolic syndrome and diabetes. Metabolic syndrome is the precursor to diabetes, and eventually that can, if not taken care of, develop into diabetes. This has a lot of effects on the brain. It increases inflammation. It increases a process called glycation. All of these things are very, very bad for the brain. So we must make sure that our diets are good so we don't develop diabetes later in life. So what does Alzheimer's disease look like? I think in the late stages, most people recognize it as their loved one's inability to perhaps recognize surroundings, remember things, different parts of their life. Those are pretty obvious. The earliest signs, we don't generally include problems like word finding or remembering that person you saw on the street, remembering their name. Those are generally not included, although they can be the earliest signs, but we don't worry so much about that. What we do worry about is the inability to learn new things. That is a big problem. We also worry about, is somebody repeating themselves? Are they asking questions and then asking them again later, perhaps in a half an hour? Those are ominous signs. Those are the very earliest signs of Alzheimer's disease to look out for. So what causes these symptoms? Well, it's really death of neurons in the brain, or nerves in the brain, and also a low number of synapses. So each neuron is perhaps connected thousands of times to other neurons, and those are called synapses. When those begin to die, we start to see the symptoms of Alzheimer's develop. Now, there are some things that we know accelerate the death of neurons and the reduction of synapse number. Head trauma is one of them. Stroke is another. High blood pressure is another. Diabetes, high cholesterol, high homocysteine. Homocysteine is an amino acid that is necessary, but in high levels can be inflammatory. And then low exercise, and of course genetics. So again, there are some things in there that we can control. Stroke is related to heart disease. We can reduce our risk of stroke through good diet. High blood pressure and diabetes, again, dietary problems. Low exercise. We can all exercise. Exercise is exceptionally important. There's very, very good research behind exercising and brain health. You have to exercise. Mental exercise as well as physical exercise. So these things are very, very important. So what do we do to avoid or to reduce our risk of developing Alzheimer's disease? First and foremost, it starts with diet, and that's primarily what we're going to discuss here. Diet. So what do you do? Lots and lots of vegetables. As many vegetables as you can possibly fit onto your plate, you got to have them. You want to have high quality proteins, okay? We're talking about chicken, turkey, beef, really all of the proteins are important. And then high quality fats. We don't want the wrong fats. Okay, so that's trans fats, the type you get in processed food and fast foods. Those have a very detrimental effect on brain function. The right fats are avocados, fish, that type of a thing. Olive oil. All of these are wonderful fats. Include plenty of those in your diet. Fruits fit into this as well. However, you want fruits to be a smaller portion than vegetables for sure. Having fruit once or twice a day is great. You want to focus on the low glycemic fruit. A good rule of thumb is that if it needs to be in the tropics to grow, It probably has a high glycemic index and will spike your blood sugar. And you want to generally have those in moderation, and have lots of strawberries and blueberries, but have those just once a day. Don't make them an all-day, everyday type of a thing. There are some supplements that have some very good research behind them in terms of reducing the risk. Most of these right now are observational studies, but observation can be very, very important, and we're starting to see that more and more it's holding true that these are very valuable for long-term health. Fish oil is a big one. Certainly you want to include plenty of fish in your diet. Likely you will have to supplement, however, with a fish oil. And these are very important because not only is the brain made up of 60% fat, the DHA that's in fish oil is particularly important for brain health. It makes up the membranes in our brain. It makes up the myelin, which is the insulation around the nerves. So these are very, very important. Vitamin D. I'm in the Northeast, of course, and we don't get a lot of sunlight here in the winter, so vitamin D is particularly important if you're going to be in the Northeast, but everywhere it's very important. There are lots of studies, and the research is very good, that shows an observational link between low vitamin D levels and an increased risk of Alzheimer's disease. So that's something very important to do. And then coconut oil. This is another good fat, although it's a saturated fat, and sometimes there's mixed information about saturated fat out there. This is a very good saturated fat. It comes with medium-chain triglycerides, and these medium-chain triglycerides are a great source of energy for the brain. And there's very good research to show that those who consume coconut oil that's high in medium-chain triglycerides actually do much better on memory scores. Those who have Alzheimer's disease do much better on memory scores than those who do not. And as a matter of fact, there's a medical food out there that's recommended for patients with Alzheimer's disease, and the primary ingredient is medium-chain triglycerides. So coconut, cook with it, eat it raw, put it in your salads, do whatever you can to get more coconut in your diet. That's all we have for today. If you have any questions, please feel free to call the office. We'll be happy to answer your questions, and we look forward to hearing from you.